my name is Jasmine Pope. I am recording how to give an enema. I'm going to verbalize it for Professor Norma's Fundamental Skills Lab. First things first, I would obtain a informed consent stating that I can give the enema. I would identify any type of allergies or issues that would interfere with the enema itself. Of course, I've knocked on the door, I've washed my hands, I've had the patient state their identification and date of birth. I'm providing them with reassurance that everything's going to be okay. I'm going to help them. I'm going to make sure that I maintain the patient's dignity and privacy at all times. I'm going to make sure that, again, I have on the proper PPE, maybe like a cover over my uniform just in case things get wet. I would make sure that when I take the enema out of the box that it's intact, the tip, and that everything's ready to go, that the solution is warm and not freezing cold. I would tell the patient to lay on their left side, making sure that the knees are drawn to the chest. This helps the fluid flow more freely into the rectal area. Gravity is what allows the enema to distribute into the rectum. I would make sure that I have an incontinence pad underneath the patient so the fluid can come out. I would make sure that I am assessing the area and performing a rectal examination if it was not done by me. I would make sure that I break the enema seal. I lubricate the nozzle. Any air should be let out. I would gently separate the buttocks of the patient, identifying the anal area, making sure that the nozzle to the enema is lubricated, and I would insert into the rectum very slow, maybe about 10 centimeters or so, the tip into the rectum. I would make sure that I start to expel the contents, the fluid, into the rectum, rolling the container from the bottom up to make sure that there's no backflow of the solution. I would make sure that I keep the container rolled and compressed before withdrawing, and then I would perform perianal hygiene. I would ask the patient to keep the enema fluids inside the rectum for as long as they can, or I would just read the enema's label, seeing what the manufacturer recommends. I would then provide a commode, and I would let the patient know to call me once they've gone. I would, of course, dispose any waste, remove any type of PPE, wash my hands. I would document the procedure very efficient and accurately. And then I would make sure that the patient's okay, safe, has their call light, everything like that. Thank you.